Today we're going to explain evaluation and management coding, otherwise known as E&M coding, and why it's important to you. E&M is a coding process in support of medical billing. E&M codes can be used to select a level of service in many settings. Today we are talking about E&M codes specifically for office visits, but the same key components of E&M are used to determine the code for other settings and procedures. It's important to understand that clinical language is not the same as coding language. One of the first things you need to know is whether a patient is new or established to your practice. A new patient is one who has not been seen by you or a member of your group and same specialty within the past 3 years. For proper documentation of E&M services, a chief complaint is necessary for all visits. A concise statement of the symptom, illness or reasons for the patient's visit is required. If your clinical staff documents a reason for the visit when rooming the patient, the provider must revise or confirm that as a chief complaint. There are 3 main key components of an E&M visit: history, examination, and medical decision-making. History is comprised of 3 portions. First, history of present illness, or HPI. Second, review of systems, or ROS. Third, past, family, and social histories, or PFSH. HPI can be for an acute or new condition. Patients are describing their present illness in their own words.
I've had a dry cough and nasal congestion for 3 days.
HPI can be described by elements such as location, severity, timing, duration, quality, context, modifying factors, and associated signs and symptoms. At follow-up visits, the HPI may be best documented by describing the current status of each of the chronic conditions. Here are some examples. Diabetes, blood sugars have been within range, patient has been trying to follow diet. Hypertension, blood pressure has been well controlled. Hyperlipidemia, lipids are within normal range. The second part of history is ROS, review of systems. ROS is an inventory of positive and negative symptoms the patient may have related to their chief complaint. If obtained by clinical staff, information must be reviewed and confirmed by the provider. The third component of history is PFSH. PFSH includes a patient's past medical history, family medical history, and patient's social history, such as age-appropriate activities. If these are obtained by clinical staff, they must be reviewed and confirmed by the provider.